Hi everyone, I'm going to be giving my speech on gingivitis. I'm currently in the dental hygiene program, so I figured this is a topic I know a lot about, and it's also just good information to have. So, gingivitis. What is gingivitis? So, it is an infection which causes inflammation in your gingiva, also known as the gums that surround your teeth. It's a type of periodontal disease. There are multiple different diseases that can occur in the mouth. Gingivitis is one of them. There are two types, plaque-induced and non-plaque-induced, and it can also be generalized, widespread throughout your whole mouth, or localized, just contained to a few teeth or a certain area. Gingivitis is also reversible, so any kind of overgrowth, inflammation, redness, all of that can be restored back to typical health. So the signs and symptoms. Gingivitis typically has some redness, swelling, bleeding, especially when you're brushing or flossing your teeth. You can have recession where you see the roots of your teeth, or overgrowth where the gingiva is so swollen that it kind of starts to cover your teeth. You could also have pain and tenderness and even bad breath. So on the left here is healthy gums, and you can see all of this is pretty much the same color. It's all pink, looks very healthy. And then if you come over to the picture on the right, you can see there's kind of an outline of red surrounding most of the teeth, and that is the inflammation going on. And that's where the gingivitis is. If you take a look over at this animated picture, you can also see a bit of the roots showing. That is the recession that can occur. And so the two types of gingivitis. Plaque-induced is exactly how it sounds. It's a buildup of plaque and bacteria around your teeth and your gums. This irritates your gums and causes an infection, and that's what gingivitis is. So making sure you're brushing every day and flossing every day to get rid of that buildup is important when it comes to gingivitis. The other type is non-plaque induced, and this is typically due to hormone changes such as pregnancy, medications, anything that kind of affects your systemic health, and smoking. So if you take a look at the picture on the left, you can see this kind of buildup around those bottom teeth. That's plaque and bacteria. This bacteria also naturally occurs within the mouth, and you always have bacteria in your mouth. It kind of just depends on how your body reacts to that bacteria and how much is there. Non-plaque induced, you see we still kind of have this redness along the gum line, but you don't see any plaque built up around the teeth. So prevention and treatment of gingivitis. Prevention is very straightforward. Basically, you just want to make sure your teeth stay clean. So you can do this at home by brushing twice a day for 2 minutes each, and then flossing once at night. You'll also want to have frequent dental cleanings at an actual office. Dental professionals are the only ones who can clean deep under your gum line and remove any bacteria that's built up down there. This is an area that you can't reach by just brushing and flossing. Another thing you can do is use an anti-gingivitis mouthwash, such as Crest Pro Health. Anything with alcohol is also very good, but you run the risk of drying your mouth out if you use alcohol products. And then also avoid smoking or stop smoking. So for treatment, you can either there's a few ways to go about treatment. So the number one thing is home care. Even when you go into an office and get a cleaning, you only see your dentist probably once a year or once every 6 months. So they do a very thorough cleaning, but it's your home care that you're doing every single day that's really going to impact your health. So you'll want to make sure you're brushing and flossing every day, and that can most of the time calm gingivitis down a bit unless you have a lot of buildup under the gum line. And at that point, you'll want to go to a dental office and have a complete cleaning or debridement where we use these instruments and kind of scale plaque and bacteria off of your teeth. So what can happen if you don't get it treated? So gingivitis, as I told you, is a type of periodontal disease. Well, periodontitis is also a type of periodontal disease. And periodontitis is bone loss around your gum, or around your teeth. So we all have bones that really circle our whole tooth and they help hold our tooth in place. So with periodontitis, that bone begins to break down, which causes your gums to recede. It can lead to tooth mobility, wiggly teeth. You can even lose your teeth, and the damage done by this is irreversible. You can have bone grafts done and surgery to kind of make it look more aesthetic and look nice, but you'll never be able to fully restore the bone and the structure surrounding your teeth. And so this is an example over here. You can see these are the roots of the teeth, and you've got a lot of recession. The gums are kind of sitting lower than they should. You can see a lot between the teeth. And so that's why it's important to brush and floss every day and also have routine cleanings when you can. So, yeah, that is gingivitis, and I hope you guys learned something from that.